I always say that the only thing that you possess in life, from the day that you were born till the day that you awake for your last breath, it's your body.
The vision, a world where all people live free of the burden of drug abuse. This is the Drug-Free America Foundation's Pathway to Prevention podcast, where we are committed to developing strategies that prevent drug use and promote sustained recovery. Thank you for not only tuning in, but your continued support and efforts to help make this world a better place. We hope you enjoy this episode. Hey everybody, this is Dave Closson from the team here at the Drug-Free America Foundation, and you're listening to the Pathways to Prevention podcast, the show where we chat with stakeholders from across the drug demand reduction spectrum about current trends in the global substance use pandemic, strategies to reduce drug demand, and how to best adapt those strategies to the ever-shifting substance use landscape. Today, we are talking about helping youth identify, understand, and manage emotions. And the mission of my guests here today, their foundation that we're going to share with you, the mission is to disseminate knowledge on the adverse effects of drug use on individuals, family, and society, and to break the taboos that exist around drug use and enable people to reach out for help. The foundation aims to play a role of catalyst for the youth and the communities they live in by engaging federal and provincial governments to take up the task through policy making on drug production, prevention, and use. Cristina, welcome to the podcast.
Thank you. Nice to be here, Dave.
Indeed, been looking forward to our conversation since we had our planning meeting last month. I know we have chatted before hitting record today, but could we start off? Would you mind introducing yourself, sharing where you're at in this world and led you to working in your current role?
My name is Cristina von Sperling Afridi. I'm living in Pakistan for the past 23 years. I'm Brazilian by birth and also fourth generation of Germans in Brazil. So I got married to a Pakistani diplomat. My husband was the ambassador of Pakistan in Brazil at that time. And we shared a common hobby, which is horses. So he was a polo player and I was a horseshoe jumper. So therefore, I end up, we had gone in many places in the world, in many countries, but here I am for the past 23 years in Pakistan. The reason that we have this foundation that came to exist 8 years ago, it was because I lost my only child due to the menace of drugs in Islamabad, the capital of Pakistan, 8 years ago. So therefore, I was a businesswoman. I had other business and interior designer, and I left everything. And I decided, because you can imagine a mother to bury a child. He was just 19 years old. I mean, it's not easy. So I left everything that I was doing, and I decided that it's my mission now to make a foundation, to open up a dialogue with the society and put up an organization that will talk about drugs with the youth in the name of my son. Therefore, KKAWF is Karim Khan Afridi Welfare Foundation. It's his name. He was just 19. A little gem of boy, went to a party, didn't work, recreational, whatever he has taken there, and he never came back.
Thank you for sharing about your son, the loss. That makes my heart heavy. But I do see where your passion, your drive comes from, to honor your son through the foundation. That is beautiful. Thank you for sharing that story with us. I would like to learn more about the foundation. In the introduction, I shared the mission, but could you tell me a little bit more about what you and the team do through the foundation?
Yes, sure. Our team we are basically prevention. That's we are concentrated on, because we believe that there is a big gap. And as we all know, that drug is a taboo in most of the society, in the complex society that we're living in, like in Pakistan, even worse, because there is no really dialogue. And we were the first organization here to talk about prevention. I have to tell you, for instance, that when my son passed away, I said, I'm going to make a foundation. And I was telling people that I'm going to do a drug awareness foundation. And my son's friend came to me and said, Auntie Cristina, why are you telling people that he died of drugs? I said, because that's the truth. I mean, are you fool? What should I say? He said, oh, why don't you tell that he died in a car accident? So, there is a lot of taboo, and so with this impediment of discussion or dialogue, we really don't reach anywhere. We were the first really one that in the papers, and the Minister of Narcotic Control went to talk openly, because kids are dying here every day, but they will talk that they have died with a heart attack. Now, we all know that because a teenager die of heart attack, either there is a terrible sort of a problem, heart problem in the family, or he has taken something that accelerated his heart and heart couldn't take it. So, but it's a constantly, covering up. In fact, one of our programs were quite inspired in the Canadian program that is Mother Against Drunk Drive. I had made it here, Mothers Against Drug Abuse. But nevertheless, I could not take this specific program out of the paper, because the people feel very embarrassing, and they think that if the mothers think that if they are going to talk about, it means that their son or daughters are drug users. So it is very difficult to bring prevention, because that's what we believe, that prevention is the cure. There is nothing else. It's to talk, and what we do. And our foundation stands on 5 pillars. That primarily, yes, is a drug awareness, environment, sports, arts and culture, and civic sense. We put all these elements, so we combine in every event that we do. And in every event that we do on these pillars, the involvement is with the teens and with the preteens, that the focus is on them. We've been getting wonderful results, because that in the era of technology that we live in, each one is looking at their own mobile now, even sitting together. So that eye-to-eye contact, that dialogue does not exist anymore. It's just basically through some sort of equipment, machine that you correspond, and and you show your affection. So there is all the time something in between, not like before. It doesn't mean that before there was no drug, but the incidence now is much higher. You know very well the types of drugs that are available. In Pakistan, for instance, now it's ice everywhere. And ice, how it's highly addictive. And heroin, of course, is the traditional, let's sort of say, classic drug here. And hashish, of course. We have cocaine in this area. And due to this proximity to Afghanistan, we consider this really a drug trafficking corridor, because everything passed through here, through Pakistan. Currently, the population that we have, young population, 135 million below age of 30. And this is an amazing contingent. And there is not really, it's not been taken by the government. I mean, not been showing the responsibility of look after this contingent as supposed to be. I always refer that someone in one of our events that in fact we just did one in volleyball that's supposed to have been last December in commemoration of International Overdose Awareness Day. We play with the dates because of the severe weather, either too cold or the hot, so we push accordingly. But this is because it was a political problem in the city, so we have to postpone our event for now. And this is that we call the Sport is the Answer. This is our project that Save Tomorrow. Sport is the answer. That to have a drug-free Pakistan. Always talk about the Olympic chart. Who are those countries that are topping for decades the Olympic chart? The United States, Russia, Japan, China, and Germany, and immediately one can connect what are the roles in the world. They're leading the world because only sports can give you discipline and unity. And we emphasize on the team sports that today we need support of each other to help each other. And team sports are always there for you. Yeah? So therefore, volleyball, we did rugby. Every year we do a big event on different modalities of team sports. And this proved to be very successful. But unless the government does not engage or if implement its own policies, which are very good, because they say that a minimum of 4 hours of education per week, it's compulsory. Unless the education institutions fail to do so, they have to be shut. But the problem is that the policies are good, but who is going to implement them? So therefore, our foundation, we are in search and to develop a mechanism of self-defense because law enforcement has failed. Drug business is enormous. It's the second big business in the world. With that comes rehabilitation that involves so many medicines and personnel that are involved with that, drug abuse and mental health as well. So where I live outside Islamabad. Only in this place, for instance, there are 6 rehabilitation centers. But are they good rehabilitation centers? Which standard are they following? Certainly not international standard. Therefore, we are the voice as a civil society that we go to the Ministry of Narcotic Control. And we denounce this. And they said, you have control, and you're not controlling neither the same trafficking of drugs and neither the rehabilitation center. Because here there is no law for you to open a private clinic. So therefore anyone can open. And it's according to their own type of treatment and according to your pocket. If you can afford, you can go to a deluxe treatment. If you cannot, you're going to be tied up in some bed. So, and who is controlling all this? But nevertheless, we had presented one model, the national standard model, to the ministry, where they liked very much. As I said, that it should be a center of rehabilitation and training controlled by the government. So only people that have been trained in the center that is controlled by the government will be able to open a private center with the certificate of the government. Otherwise, there will be no control. So far, we are just talking at 4 corners like, talking about prevention. That prevention, only really people that focus in prevention are people that are really wise. because we all know that it's an overload in the health system of any country, because it's not only the mental problem, but it to affect so many organs in your body. So extra to go there, extra to go in the other, in the public health system. So it's a overload there. So I think it's mission forever. And it's not easy to sell prevention. It's easy to have a rehabilitation center because you have the product in front of you. But to sell prevention for someone, sponsor the continuous various programs that we have. I designed many of them. So it's quite difficult. And many of them we have right now, we are with the United Nations UNODC grant given to a program that we designed, that a video competition, that the solution of drug abuse from youth to youth. So we are in the process of finishing this and get the winner of this video, which once we are done, is going to be shown in every education institution and also in the headquarters of UNODC. So that is one of our programs. Apart from that, we are always creating some program to get closer to the community. So because there is no point. Sometimes you have conference that the audience that is there, it's an audience that's already know everything. But we go into the grassroots level. We go in every education institution, being public schools, colleges, and universities, and also on the private education institution, which the privates are in a situation that is just a narcotic, is like a pandemic. It's unbelievable the amount of consumption right now. So what we are trying to do is just to put sense in a person's mind that the only thing that you really own in your life is your own body. And it's the way that you're going to treat your body is that going to result in your life. The basic like this, how you're going to live is during your period of adolescence, that you are forming your body, forming your mind. Whatever you're going to put inside you, that's what you're going to reflect later on. So that's basically what we do. It's a non-stop job.
There was so much wisdom in what you shared. I'd like to unpack that a little bit. You had shared about the challenges you face in Pakistan with the ice, heroin, hashish, cocaine, and how it's a drug trafficking corridor and drug business is enormous. I want to say you said 135 million people below the age of 30.
Yeah.
But you have the courage to speak up and speak out against what is taboo. And it's not easy to sell prevention. Where have you found some positive success in speaking out and speaking up?
First, after I lost my son, I have to have a reason to live. And I felt that since that I have no kid, every kid is my responsibility. And that's what I keep on telling the people also. It is not, you are responsible for your neighbor kid. We're talking about the future of a nation. I talk about that drug abuse is a national security threat, especially in this region with geopolitical situation that you really don't know who is your friend, who is not. I mean, let's not forget the war inflicted by the British in China, the Opium War. So China was completely destroyed. They were all hooked on opium. Today, the Chinese super serious, the situation of drugs, the control is tremendous. Because imagine a nation that is all intoxicated, what kind of future you can expect? In this political situation that I told you, the proximity of Afghanistan And then we have Iran by our side. And then we have China. And then we have India. And so we have all this region. Because once you capture people's mind, that's why I insist on the national security plan, you capture the country. Because it's like the dog and the carrot. I mean, I put the carrot in front and I take the dog wherever it's going. So the most important thing that I believe is to look after the mental health of the youth. I should not say this, but frankly, I don't care about the older people. My concern and my focus is on the youth. That's where you have to teach them and put sense in their mind. So it is everywhere. And with this addiction, so many consequences. The word of addiction, for instance, I also insist to say in the government here that there is an underground community that we all know, that sons and daughters of prostitutes and drug addicts. So they reproduce, they continue to reproduce, they continue with the addiction. And what is there? The way that they live is under selling themselves, selling their kids. And this is not only in Pakistan, it's everywhere. I mean, you will end up in a vicious circle that you need money for your addiction, right? So you end up selling yourself and you end up reproducing. And so you reproduce, you create human beings with no moral values whatsoever. What is their value? Where they are going to hang on what is right and what is wrong. So they will not know because they are grown up in this highly addictive community. So no one is paying attention and there is no data according. It's like, they exist, but they don't. And this is the future. These people are going to grow and the criminality will increase and so many other things, consequence of this community that no one is paying attention. So I find that here, because I've been living here, and I always insist that it's alarming because it did. Like 3 days ago, we have a 13-year-old girl jumping to the 3rd floor of her school and commit suicide. So this all reflects, because I say that if we really think about how we used to behave when we were teenagers, we will understand more. We tend to forget, and then we become like our own parents. No? So we lose that sensibility. And I tell the kids that for me, the 7 years of this adolescence is the worst period of one's life, because you feel yourself so insecure. You don't know anything. You are learning. You are experimenting. You are vulnerable. And you trust people. You are a face of trust. And so anyone that will come closer become your friend. And you really do not know the intentions, because then there is that period that you know very well, because it's a common way of a teenager, that everybody is their friend but the parent. So this is a typical pattern that they will be listened to their friends but not the parents. So we try to make them understand. When I go for my presentation in the schools, my presentation will specifically, like when you talked before, helping identify, understand, and manage emotions, is specifically to what's going on during the period that you are living. I say that anyone here with the have felt choked and want to cry sometimes with no reason at all, because the hormones are playing havoc inside us. Unless you understand and you put in equilibrium, in balance, your body and your thoughts together, unless you understand what's going on in your body with the hormones during that period, you will think that you are suffering, that you are an unhappy person. How many times you slammed the door And then after you get surprised yourself, then say, oh my God, what did I do then? Shout back and you feel bad because the hormones are playing havoc inside you. And there is the only solution, and this is everyone no, there is no gender or there is no color or there is no religion that makes this difference because this is part of growing up. So if we do not understand what's happened to our body at that moment, we will think that we're suffering. And you know that all the adolescents have the problem of the word in their shoulder. They think they are right and oh God, it's everything is happening to me, and it's not. But the solution that we find, and then this I bet, but I'm also did sports throughout my life. The only solution, and I always tell the kids, I said, our body is so perfect that we have even the kick we did. We do not need extra kick because if you will play any sports, if you do any activity, physical activity that you enjoy, you will stimulate your endorphin and you will feel good. You'll feel powerful. You'll become a positive person because now everything, you know very well, I'm depressed, or I'm bored, or I'm depressed. So this is a part of, and the people accept this very easily that I'm depressed. And so it's not, it's lack of engagement with your own body and lack of understanding with your own body. For me, that is, once you understand that you have to pass all the stages thing, all this acne, the beard start to grow, the hair start to go, your voice start to change, all these things that one finds ridiculous and being bullied and laughable about when you are in schools. I mean, this everybody is going to pass through it. So this is very clear. And spoken in a community is spoken in a room with many people. So there is no doubt there. What happened to us many times is that after my talk, the girls are crying because you know very well, every house near or far has a case of abuse. And on the drug, the intoxication part of it even works because when there is drug involved, there's alcohol involved. So, I mean, it's a violent environment. And of course, many people suffer. And if it comes from the parents, the kids are going to either indulge or they will be completely out of it. And so this is a very serious, for me, today is one of the worst problems that the world is suffering is the lack of awareness, or maybe, lack of, let's say, empathy. We became quite very individualist and very robot. So we just say that's not our problem. But everything that you see, it's your problem. So it's your responsibility. It's not one person, a disease. It's the entire family is sick. The entire family get affected financially, morally, emotionally. So it's not an individual visit.
Yes, yes, indeed. And I agree so much. The focus on wellness, discipline, and a couple other words that came to mind too were self-accountability and also self-love. In my own journey with alcohol, that was big for me, was learning to love myself.
Yes.
And knowing what that meant and how to do that and letting myself do that. Yes. So you see the challenges, you see the barriers, and you still stand up. You go to the government, you go to the community, and you insist that it is alarming. Yes. And the most important.
Yeah, I say that we must continue this. This is our mission. And sometimes, how do you say that? Why me? That feeling that, I've been a good person and why should I lose my only child? I mean, didn't get that feeling. But someone has said to me, said, look at this way. You came from Brazil, you married a Pakistani. I mean, different countries, different cultures, different religions. And then you end up living in here and you lose your only child. And maybe that was written for this mission that you had. And maybe I take as a consolation, as a solace, I feel good to what I'm doing. But I wish more people will be involved in that. Unfortunately, like I said, it's taboo. And if anyone is a drug user, they will not get married. The family will find out and they will not find a pair for that boy or for that girl. So everything becomes very difficult. So you end up living in a hypocrite society. You see, one thing is what you are for your parents, and the other thing is what you are outside. So you really live double life, a double personality, which is most of the time are in conflict. So unless one address even parents wise how they should see that the kids have the right to choose. They have the right to choose their career. They have the right to choose their partner, which in this kind of society is not there. It's been already decided what you're going to be. So your choices, your decisions to lead a life been done by someone else, not by you. And you will not challenge there because it doesn't look good. Because at the end of the day, it's known that the family knows it better. The youth is very squashed in the sense that why should I go? And if they have a talent, for instance, the profession most valuable is either an engineer or a doctor and this again. I'm always telling them the schools don't like, but I say that let me in this school that let them decide what they want to decide. Because we have only one life that we know. If we spend that life doing something that you don't enjoy, this is a miserable life. I have seen in myself so many doctors that have been made doctors by the family, but they have no talent whatsoever. So when you go to a public hospital, the doctor is just looking at his Facebook, his mobile, while the corridor is full of patients. There is a way. So that humanity is not there because it's not his talent. Maybe his talent was a singer. So what I'm saying is that we have to have responsibility for our failures, for our destiny, but we have to have the possibility to choose, and that's very important. But in a complex society that we live in, it's many times in the West, for instance, you don't even know what you want to do. But here, there is a debate and the person will decide, the family will decide what to do. Like, for instance, is a family of doctors, they're all doctors. And when the one that doesn't decide to be a doctor, so he looks like black sheep, the family. So this is our awareness. It should not be just focused on the adolescents, is our main focus, of course. But we should also be looking after the parents, the mothers and fathers, which should understand better that, each one should own their own life and make it easier. Maybe you will have less frustrated people. Huh?
Yes. And that is that. And I will not summarize that because that was so beautiful. I would like to visit about the 5 main guiding spheres of interest for the foundation. I know you had shared those with us, but you shared them so quickly. I think they're important, and would love to learn more about the 5 pillars of drug awareness, environment, sports, art, and culture, and civic sense. Can you tell me more about those?
Yes. For instance, on the drug, I think I spoke a bit on the environment. I mean, I'm an environmentalist, and what we do is that I live close to a river. And every year we have this Run Clean. The name of the river is Quran. So we get like 10, 12 different schools, and we make on the shore of the river, we divide the shore of the river in stations. And then with lottery, the different schools, they are going to get their stations. And there is, we make them clean. Whoever cleans more bags full of dirt or whatever it is, residues, they will win the competition. So it's a very fun, it's an outing with music, with lots of talks. We get the press for them to get excited. We put a boat in the middle of the river, flags everywhere. And we have a point because we invite the underprivileged schools and the privileged schools, the chain of big schools that we have. We put them all together. We make a point that all events that we do, we use T-shirts. We make T-shirts because everybody's equal. So we do not want people to differentiate through their social class. So whoever is a cleaner or a driver's son or whatever is this, I mean, has the same treatment and the same. So there, it's already a message in the bottom. We do not accept any kind of social difference. Yet there are, but we do not accept on our event. And this is a very interesting event because, of course, it comes everywhere in the media. So the kids, we have a big, not lunch, but brunch. So all kinds of things, ice cream, this and that. So, and their participation, it's amazing. Today, we have so many that on and off I meet them. Oh, I will, Auntie Cristina, I always remember the day that we spent there doing this and that. So at the same time, they are together, they are competing because I do not agree comparison like someone is better than the other. I don't agree with it. But I think that all have to have competition and they have to prove themselves. This competition academically, that of course there is some that are genius, there are some that excel, but it's not making this culture of straight A's, is stressing all these kids. And I said that we should not do this. We should focus in the human aspect of it, because now what we need is good human beings. Forget about this academic, this fixation of academic. I mean, we need good human beings. So the environment, it's, you know how it is. People throw things everywhere. It's outside of their house and then throw everywhere. We create a conscience that it's not only your house, it's wherever you walk, you have to look after that place. So you have to keep clean. In fact, our motto is like stay clean in every sense. Clean yourself, to stay clean away from drugs, keep the other things clean, so stay clean. So this is the environment, and many times we do it in the park. So we take them out, yoga in the park. So we bring people to do a bit of yoga, which is interesting. Everything is new. And when the volunteers work with us, many of them, as I mentioned before, are underprivileged. But we take them, for instance, I take them to Polo Club. So we are going to have their things. So we're exposing them in different ways to the golf club, exposing them the volunteers that work for us. After every event, we take them somewhere for a picnic. And so we keep on exposing them of different things aspect of life. Right? So they mature that. And environment, sports, as I told you before, sports is the answer. This is our program. And everything that we have done, cycling, football, and rugby, volleyball, and so much. And I only like to work with the best athletes nationwide because they all belong to the national squad, the national teams. Because when you ask someone to come and watch sport, we want to show the best to inspire. No? So we create heroes that it's not there. The sports here is very, as I told you before, very, it's not being looked after. As long the parents think that as long the kids are inside the house, they're safe. But I said, safe how? Do you know what they watch through the computer? You don't know. Another great addiction that destroys so many as well, pornography. We all know. Addict to pornography. So this is another terrible thing. So I said, you don't really know. What we need to is to bring the kids out. You are always going to remember in your life the outings that you have done, that you had gone to your uncle, but you had gone for a hunting, for a swimming in a fall or some, but you will always memorize that. You are not going to memorize your childhood when you stay inside the house. Because here the weather is very severe, it's very cold or very hot. But nevertheless, I said there is no bad weather. We go out. So to endure bad weather, it's good for a human being. And then someone say, oh, but it's going to rain. Bring your umbrella. But, oh, it's too hot. Bring your bottle of water and put your cream in your face and your hand. You see? So we do not accept excuse because we have to endure the weather, and this is the way that it should be. And arts and culture, we got the best practice by UNESCO during COVID. We had done national competition on poster arts competition. Again, a solution of COVID to the eyes of the youth. And it was really very exciting there. We got 3 artists to be in the jury. So it was very exciting. So we were acknowledged by UNESCO through that. Every event, so we have a week program in a school, start with my talk, and then all this involved, environment, we make a school plant a tree. The school all becomes like a red or, with the posters. So everybody is involved and know what's going on. When you're doing a poster competition, their work is on 4 to stimulate debate. You see? So 4 people withdraw 1 poster. The individual only is their essays that, of course, you see so much red alert. Also that we advise the schools and we created data. When I finished my job, we were surveyed with just not a very deep 5 questions only with no name, obviously, but age and gender. Have you ever taken a drug? Do you have a friend who uses drugs? Things like this. So we put that and give to the principal of the school after this result of the survey. So for they more or less feel the pulse, what's going on in their own institution. So this and civic sense is very important. Like we're saying, that to leave people path behind, to open the door for someone, to be kind and gentle to someone else. This is all parts to being the civic sense. So to love your country, to, be a good human being, to know how to differentiate what is right and wrong, and how you will continue to help and facilitate your neighbor, people that needs. And if someone wants to pass, you will let them pass before you and not just trafficking. So it's a basic education on how to live in community in a civilized manner. So we believe that with all these pillars that we have combined, we hope that to make good human being that way to collaborate and make your one's country better, and the future better. And in learning, you will part, and with the same intensity that we do with the boys, we do with the girls, because the problem is equal. It's not more. The boys, they take drugs, girls are taking drugs alone. And with the problems also, the puberty and things like that, they do not understand, because biology and it's not debated, it's not discussed what you're going to go through. So we open up this dialogue and we talk about. Sometimes people get a bit like this because we talk about the girls' period, we talk about everything, so that people should know how to react. That sometimes you are so unhappy and you don't know what it is. If you are growing up, you have to understand. So if you have this conscious, so things are going to be better. We keep on going, keep on repeating, keep on going, keep on trying. We have a tremendous problem of finance, because every project, I'm really like a beggar. I go and knock at everybody, company and CSR are not used to this. Or you really want to get involved with drug issues. We don't know. But for our events, at least, we've been lucky with the traditional partners and very well concept and very well known organizations that they sponsor our events. But nevertheless, as to expand the office, we need more support. We need more support, because if we have 5 pillars, we need each pillar, we need someone focus on that. And not only because we end up with the hands tied, because we want to expand the entire Pakistan. Because to move, we have to move our own team from here to Lahore or from here to Peshawar. We want to develop every province. We want to develop a different office, so we will have that uniform campaign that it's continuous.
And for the listeners, I will put a link to the foundation's website where you can learn more. So look in the show notes, listeners, for that link. And also, I'll put the links to the foundation's social media, Facebook, Twitter, YouTube, Instagram, there as well, so you can get connected with Cristina and her team. Cristina, you shared so very much with us today, from talking about the challenges, the problems with the drug trafficking corridor, and it's not easy to sell prevention. And then you enlightened us with how you're able to accomplish so much, and that the most important thing is to look after the youth's mental health. And there's only one solution. Those 5 pillars that you just unpacked for us. I love how all of your programs are in alignment and speak to those 5 pillars, which help advance, get the youth outside, get them engaged, and support them identifying, understanding, and managing their emotions. The true comprehensive approach, that dynamic, multifaceted approach to prevention it's beautiful. We've been talking for a while, and I want to ask one last question for you, if you don't mind. If you were to give our listeners one piece of advice that you want to ensure that they remember after listening to our conversation, what would that piece of advice be?
Well, to our listeners, the young nods, I always say that the only thing that you possess in life, from the day that you were born till the day that you awake for your last breath, it's your body. It's undeniable that how you treat yourself It's how we're going to flourish or how we're going to develop and how we're going to grow. So I always get as an example, if you're planting a tree, you are not going to water this tree, this little tree with Coca-Cola or whatever. It's not going to survive. But if you plant this tree and you put water, which is pure, tree is going to become beautiful. So it's the same thing that happens to us. Why we are going to mistreat ourselves? This is the only thing that we own. This is the only thing that we can guarantee that is real, that it's to love yourself. It's to treat yourself. It's, I don't know, we see so many people mistreating themselves, no, because of whatever. One thing Dave, I want to say. So the main thing that I tell the listeners, look after yourself. It's to be beautiful. You don't need to have money and go to academy. You can just walk, go for a run around the lake, in the park, go up in the mountain. You see, go and waste yourself, waste your energy that will bring positiveness. So when you come down, you are another person. So drag someone with you. Someone is in trouble. Someone is a fan for this menace of this drug addiction. So help on each other. We cannot just let it, and see a news and see people crawling in front of you and not saying anything and not doing anything. We are part of each other. And one thing is that I keep on repeating that, Dave. It's that there is no one more responsible than yourself for yourself.
Yes. Yes. And I cannot summarize that any more perfectly than you did. I think we should leave our listeners with that bit of wisdom there. It has been a delight and an honor to connect and learn about all of the great work and all the lessons you've shared with us today. Thank you very, very much.
Thank you, Dave, to give us the opportunity to share with your friends, with your listeners, the work that we are doing here. And we are here. And if anyone wants to visit Pakistan, we are here to help. And we are part of you in any case. So look after yourself and hope to talk to you again soon. Thank you for the opportunity.
Absolutely. Prevention is better together, and we are all in this together. That concludes this episode. Thanks for tuning in. Be sure to hit the subscribe button and share this episode with a friend before you leave. And we look forward to seeing you on social media, because prevention is better together. Together, we are stronger.